Hope springs eternal, but often the pump must be primed, and no one works the handle more diligently than John P. Howe III. An active leader in the fields of medical diplomacy, health policy, and business, he served for 14 years as president and CEO of Project Hope, an international organization that provides health care, often as a first responder to disaster and crisis for the world's most vulnerable populations. During Dr. Howe's tenure, Project Hope lived up to its name, carrying out numerous relief missions while expanding in distribution of medicine, treatment of disease, and promotion of health education and life improvement for women and children. Dr. Howe also served 15 years as chief executive of the University of Texas Health Science Center at San Antonio and remains president emeritus. Under his guidance, the medical, nursing, biomedical sciences, pharmacy, dental, and allied health sciences programs all rose to national prominence. Prior to that, he helped develop the University of Massachusetts Medical School, ultimately serving as its academic dean and as vice chancellor of its medical center. Throughout his career, Dr. Howe has advocated for the importance of medical research. He has spoken in more than 30 states and 20 countries, presented testimony to Congress, and written or co-written more than 45 articles, chapters, and abstracts. Dr. Howe is a graduate of Amherst College, Boston University School of Medicine, and Harvard Business School's program in Health Systems Management. He is board certified in both internal medicine and cardiovascular disease. Among his many awards are the U.S. Army Commander's Award for Public Service and the Surgeon General's Exemplary Service Award. Dr. Howe serves on the Board of Trustees of Boston University and the Board of Visitors of the Boston University School of Public Health. He has received distinguished alumni awards from both the university and our School of Medicine. Will you offer a warm Marsh Chapel welcome to this year's baccalaureate speaker, John Howe?
We come together on a very special day in the life of Boston University, Marsh Chapel, and the class of 2019. For the university, it was just 150 years ago that the governor of Massachusetts, William Claflin, signed the Act of 1869, which first chartered Boston University. For the chapel, it's now 70 years since its groundbreaking in 1949. And for the graduates, it's the 146th commencement of the university, a very special day indeed. In preparing this year's baccalaureate address, I reviewed the messages shared from this pulpit by my predecessors in each of the past 10 years. Dr. Gloria White Hammond spoke of stepping up with courage, stepping out on faith, stepping forward with determination. Dr. Wafa Al-Sadr, never succumb to the culture of no. Dr. Ahmed Zowail, hard work and compassion are required for a good life. Judge Sandra Lynch, use the tools of democracy, free speech, and voting to keep our country safe and flourishing. Bishop Peter Weaver, dream with your eyes open. Dr. Nancy Hopkins, complete the social revolution. The Reverend Cornell Brooks, the surest path to meritocracy is diversity. Dr. Carrie Hessler-Radley, choose optimism, make relationships your priority, and make service your mindset. Dr. Mario Molina, use the skill of how to learn, which you gained at BU. And lastly, 1 year ago, Carmen Yulin Cruz Soto, change the world we live in, stand up, be fearless, and be counted. I then spent a delightful afternoon with 3 leaders of the university's senior class, 3 outstanding young women majoring in advertising, history, and international relations, and asked them for their observations with respect to the university and beyond. They told me how the university had changed their lives and had prepared them for a global society, how they gained a greater sense of self and purpose, developed confidence and found their voice, and how, with time spent overseas, they had become, in their words, citizens of the world. They were inspiring in their wish to use skills and talents gained at the university, again, in their words, to make a difference in the world. With this in the way of background, I will now depart from the traditional themes of past baccalaureate speakers: integrity, courage, independence, tolerance, to address a theme inspired by these senior class leaders, and that is the theme of making a difference in the world. I will do so by sharing my experience of using a Boston University medical degree to make a difference in the world by engaging in what is known as citizen diplomacy. Diplomacy in which ordinary citizens play an important role. And I'll cite examples from Indonesia, China, Iraq, and here in our own country, Mississippi. The call came from Admiral Vern Clark, the chief of U.S. naval operations after the Indonesian tsunami. He said, "Doc, this is Vern Clark, the CNO. I have a novel idea. What isn't novel is to send the Navy hospital ship Mercy to Banda Aceh. What is novel is it be staffed by you, not the Navy. This has never been done before." The 1,000-bed hospital ship Mercy arrived in Banda Aceh with 220 Project Hope volunteer physicians and nurses, 2/3 of them from Boston in the Massachusetts General Hospital, who then cared for 50,000 patients before returning home 6 weeks later. The impact of the volunteers could be described in human terms as well. One of the 50,000 patients was little Iqbal. Little Iqbal, an 11-year-old boy, was fishing with his dad when one of the 3 100-foot tsunami waves threw their wooden boat against the shore, killing his dad. The boy suffered a cardiac arrest, was intubated by a volunteer physician, and was flown to the hospital ship. 2 weeks later, Iqbal, as he was leaving the ship, the commanding officer of the ship gave him a traditional captain's coin. 1 year later, when the hospital ship returned to Banda Aceh, little Iqbal ran out onto the dock and showed the coin to one of the volunteer nurses who had saved his life the year before. He told her, "Every morning I rubbed, and I rubbed it, hoping the ship would come back," and it did. Surveys conducted after these visits to the hospital ship Mercy to Indonesia, a country with the largest Muslim population, showed dramatic improvements in attitudes toward the United States, a doubling of the percentage of positive feelings toward the U.S. compared to similar surveys done before the tsunami. The call came from the president of China. President Jiang Zemin asked me to meet with him in Beijing. When I arrived, he said, "You're probably wondering why I asked you to be here. I want to express my appreciation and the appreciation of the people of China for the work of the Foundation volunteers in the creation of the Shanghai Children's Medical Center. In addition, I want to thank you for responding to my request to train more than 200,000 healthcare workers in diabetes prevention." Again, in human terms, 2-year-old Ha Ching Cheng arrived in Shanghai with his mother after a 2-hour plane ride from Wenzhou, a city of 9 million in Zhejiang province. He was diagnosed with a potentially life-threatening form of congenital heart disease and received corrective heart surgery the very next morning. This was only possible because Dr. Richard Jonas, an internationally known pediatric heart surgeon, formerly at the Boston Children's Hospital and now at the Children's National Medical Center in Washington, came to Shanghai as a foundation volunteer 1 month a year for 10 years to train pediatric surgeons in Shanghai to become congenital heart surgeons. Last year, the surgeons that Dr. Jonas trained performed over 3,700 open heart surgeries on infants and children at the Shanghai Children's Medical Center, 2/3 of them under 3 months of age. The call came from the office of the First Lady, Laura Bush, a few weeks after the Iraq invasion. She and the National Security Advisor, Condoleezza Rice, asked me to go to Baghdad and Basra with 2 members of their staff and report back on the health of children in Iraq. The last 20 minutes of the flight into Baghdad had a corkscrew approach to avoid being hit by a missile. The road from the airport to the city was called Suicide Alley. We found the prevalence of childhood leukemia in Basra to be 10 times what it was 10 years before. No new hospital had been built in Iraq in 29 years, and all the country's nursing schools had been closed. We were then asked by Mrs. Bush and Dr. Rice to build a state-of-the-art children's cancer hospital in Basra. The Basra Children's Cancer Hospital was completed and opened 6 years later. Its first patient, a tiny little Iraqi boy named Amir, came from Baghdad. A CAT scan and biopsy confirmed a high-risk cancer, neuroblastoma. Following chemotherapy, the hospital surgeons, trained by the volunteer physicians from the foundation, were able to remove the entire tumor. After additional chemotherapy, little Amir returned home to Baghdad. A year later, he was reported to be completely well. And 2 years after that, the governor of Basra asked the granddaughter of the Grand Ayatollah of Basra to come to Washington to share a message with me, a message of thanks, and also share the news that he had just approved a doubling of the size of the hospital. And lastly, the call came from Mississippi Senator Trent Lott. Hurricane Katrina, the deadliest U.S. hurricane since 1928, had devastated the Mississippi coast and its 3 coastal counties, Jackson, Harrison, and Hancock. 90% of the structures within a half-mile of the coastline were completely destroyed. The Navy hospital ship Comfort arrived with 75 foundation volunteers who identified hundreds of patients whose lives had been threatened by the destruction of their clinics, physician offices, and pharmacies, and brought them to the ship where their uncontrolled diabetes, hypertension, and cancer were stabilized and their treatments were restarted. Governor Haley Barbour drove from Jackson, Mississippi, the capital of the state, to thank the volunteers upon the reopening of a primary care clinic in Jackson County. These are but a few examples of citizen diplomacy at work. Again, diplomacy in which ordinary citizens play an important role, made possible in part by medical education and medical education at Boston University. What began with training at the School of Medicine led to roles and responsibilities in academic medicine as a professor of medicine, academic dean of a medical school, and the president of a major academic medical center, followed by the presidency of a global health foundation with people and programs in 35 countries. All were made possible with the encouragement and support of mentors. Aram Chabanian and Louis Sullivan at the Boston University School of Medicine, Jim Dowland at the Peter Brigham Hospital, Roger Hickler at the University of Massachusetts Medical School, Roger Bulger at the University of Texas Health Science Center at Houston, Charlie Sanders at Glaxo, and Shirin Kelly at the White House. It was Robert Goheen, the 16th president of Princeton, who, in one of his last baccalaureate addresses, spoke of, and I quote, the importance of conjoining the life of the mind with moral concern. This conjoining of the life of the mind with moral concern, it was what lies at the very heart of citizen diplomacy, so sorely needed in today's world. It lies at the heart of the 3 senior class leaders' description of how they will leave Boston University today as citizens of the world. Just as Isaac Rich, the founder of Boston University, sailed away from Boston at age 14 on a three-masted schooner, later to achieve prominence in his chosen field of business, I have every confidence that the outstanding young women with whom I met, Cleopatra Deserlin, Adia Turner, and Carolyn Hoffman, and their fellow 2019 graduates, will sail away from Boston University later today to make a great difference in the world with the best of mentors and the best of networks. So with respect and admiration, I close by saying to them, bon voyage, and in this hallowed space, Godspeed. Thank you.